we have Samuel and Garrett, and my name is Valita, and we will be doing, we're looking at dengue control. We're actually looking at, we're thinking of India and helping them with their problems with dengue. So we found out that dengue is the most rapidly spreading mosquito-borne viral disease in the world. And in the last 50 years, the incidence has increased significantly by expanding its geographical locations to new countries and has become prevalent both in the urban and rural areas. The the South Asia region and Western Pacific region bears nearly 75% of the current global disease burden. So the Asian Dengue Specific Strategic Plan is what we'll be looking at to see how they did things and how we can implement or improve things. So in India, we noticed that India is in the Southeast Asia region, and they are trying to deal with eradication, but it's not working out yet. And the World Health Organization is also looking at best practices and helping to bring successful results. So now I will be looking at my section, which deals with dengue surveillance and case management. And in that, we're looking at what the studies on dengue and the persons that are the hosts, and how best we can try and come up with a plan to do to have a vaccine or a drug available for dengue, because I think that's the way forward right now based upon the cases that we're seeing. So we found that dengue has 4 serotypes, right? And these of the 4 serotypes, which is dengue 1, 2, 3, and 4, the Asian genotypes, dengue 2 and 3, are frequently associated with severe dengue accompanying secondary dengue infections. So we're looking at maybe doing a serotype specific cross-reactive thing where we can look at the antibodies and how the T cells react, because it's measurable for years after a dengue infection. So currently, globally, the classifications have been given as dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. Those are the way people are classified when it comes in. So the classification into those levels of severity has a high potential for being a practical use for the clinicians, which are the doctors, to make decisions as to how they're to treat the patients. Okay, so it's more consistent also with the reporting and whether nationally or internationally, to look at the measures that needs to be taken, whether we need to give the person a vaccine or give the person drugs. So I have found out that in the Americas, there was a time when dengue was being eradicated. And it's the lowest in the Americas too. But in the 1960s to 1970s, they were doing something at that time that caused America to be kind of dengue free. But because they were not following that practice, dengue started spreading and getting worse. So we need to find out what it is that they had been doing in those times. But in the meantime, I have found out that in interrupting the dengue transmission, we need to look at the cost that will be incurred, and also the partners that we need to put in place or to get to have aboard, and also access research facilities, because we find that the virus can be separated, and we can find a a vaccine eventually it can be done. But we also have to look at travelers that are going out of the country and in the country. And I think Garrett will be looking at the communication aspect. So, but I'm looking at where the travelers are concerned. We will be looking at maybe testings when they come in and testings when they go out. So we definitely have to have an area where we're going to confine people, because there's a 4 to 10 day incubation period when somebody is bitten by a mosquito. So we have to find them as soon as they come in, and we have to like put them into areas of persons who don't have symptoms, persons who have symptoms, and persons who are really sick. And so we'll treat them that way, and hopefully we'll find a way of trying to get this thing lowered. And that's it for my side right now. Samuel?
Okay, perfect. Yeah, so my part was going to be more on focusing on how to kind of eliminate the breeding grounds of these mosquitoes, basically some vector control of the mosquitoes in the different communities, and how we can approach that. And further research in doing this, there's basically three main methods for vector control, and that's mechanical, biological, and chemical. So mechanical is basically removing those potential breeding sites for mosquitoes. A lot of those are commonly known, which was interesting to find out. Things like tires, non-biodegradable plastic containers, and covering water tanks in order to prevent those breeding grounds. There's also other mechanical things that can be put in place, such as mosquito traps, and things such as things that can prevent the the breeding to occur. There's also the biological aspect of it, which I believe China's been doing a lot of research in it. Basically, they've designed to eliminate the mosquito larvae using biological agents. One of the options that I looked into was a bacterium called Bacillus thuringiensis, something like that. I'm pronouncing it wrong, but basically, when ingested by the mosquito larvae, it synthesizes lethal endotoxins, which basically doesn't allow them to continue on. And then there's also chemical, which I don't know. There's definitely some potential health risks with that, with insecticides and things like that. Those are basically the main three vector control methods that we would want to look into to see what else could be done. Obviously, I think what's going to work best is an integrated approach where we have all these different ways of vector control, put together in a orchestrated effort. So I think that'll be key. Some other things that I researched as far as vector control can be established within the communities. And I think it starts with, raising the level of awareness, making public announcements, also education. People need to know about vector control and how to avoid getting or spreading the dengue virus. Also just education on early signs of the virus and to report it early on. Some other things that I've researched where some communities would do what they call a cleanup campaign, which would help improve the community to get rid of the breeding grounds. So that'd be something that maybe we could incorporate in the communities to help with vector control. So that's basically the gist of what I researched as far as the vector control.
That is great.
All right.
All right.
Yeah. So first of all, for anybody that's watching this, including the teacher, my my camera's officially broken. I took it into the computer doctor this week, and they said, yeah, you need to get a external camera. I have not done that yet. I apologize. Here I go. So I was looking up and researching about what India and the communities in India are doing currently, and to see if it was sufficient, like if they're kind of like Samuel talked about, if they are sharing information well enough with citizens so that they know what to do and what exactly is going on. And one of the issues that seems to be happening among the many issues that I found was that with the deaths that are happening because of dengue, many of those deaths are being labeled as a result of a pre-existing condition and not labeled as a death from dengue. And I think some of the reasons why they're doing this, and it's potentially influenced by the government, but to help reduce panic among the citizens. And so I think one of the problems that we have right now is with the numbers that we have of cases and deaths by the cases. I think they're a little off, because there's probably significantly more deaths and significantly more cases than it shows, because they're trying to hide it so that people won't freak out, so to speak. Some of the things that need to be addressed are the government's ability to react to when they start seeing dengue cases. Not only that, but they just don't seem to want to put up the right amount of information to their citizens so that they would be prepared and know what to do and know how to protect themselves, whether it be spraying things on themselves or sleeping with nets or any sort of protection from getting bitten. Many people don't know about that. And as I was reading, it would say that, 10 days after people get bit, they start to experience these things, and the government kind of sloughs it off. And again, they're pushing the response, or not the responsibility, that other word I'm looking for. They're pushing the
blame.
What was that?
The blame, or what do you?
Yeah, that's the word. Okay, yeah, they're pushing the blame onto other things and other issues, and not onto dengue. Many people don't know what to do to protect themselves from that, because the government has really resources available to citizens and communities. Not only resources, but just information about dengue fever and dengue in general and how to protect themselves. So it seems like that the biggest issue is just the ability for the government to spread information and help people know what to do in case of it and what to do to protect themselves.
Okay, Garrett, what are you thinking of would be the best way forward in educating, making persons more aware and getting the government involved along with the global partners?
Well, part of that would have to be, there would need to be money needed for newer campaigns to inform people, whether that's via print or signage and things like that around, or in any other type of media that people consume in India. There needs to be newer information, and not only that, but there needs to be correct information, so that if there is a serious issue, if it's spreading like crazy, people need to know this, because that will help reduce the spread of dengue. If people don't know that there's an issue, then they can't do anything about it.
Well, remember also that yes, if somebody's educated, it's easier for them to actually get on with trying to help with the with getting rid of the mosquitoes. But then in communities where there is low income and they're not educated in doing certain things for themselves because they're not that aware, and so they have been left out of many things.
Sure.
Do you think that it would be best for like a group of people to go into the communities, just like what I saw in the video, one of our videos, where we were able to teach the people in the communities how to what to look for, what to do, because sometimes just talking.
I think so. Potentially, I think at least based on what I read about it, it sounds like between low income and high income, they're using the same media and the same communication for both of them. And I think you're right. Those people who don't have access to maybe different sorts of media, or who live in maybe more rural communities, might have issues with actually getting that information passed on to them. So yeah, it might be helpful to look into something like that.
Yeah. And I was also thinking, when I looked at the video, we could think of educating, maybe having internal persons in the community. We educate that particular set of staff, like say a couple of people in the community who can go be the monitors then.
Like the representative for that community or something.
Right.
Like dengue, like a special dengue specialist or something.
Right. We teach them what to look for, what the things that are to be eliminated, as Samuel said, the things that we should be ensuring that is not there for the mosquito breeding ground, to fill out the breeding grounds and those things. So if we had persons on the ground who were looking at those aspects and teaching the people and looking for the signs and symptoms, that would help too, because we need people to be more, proactive.
Sure.
So I think awareness really helps in a lot of ways. And of course, if we look at how to, as Samuel pointed out, if we look at how to get rid of all those things that are causing the problem, and also to breeding grounds really, and then look at the practices of different countries that were able to target something that could kill the mosquitoes. Because but then I'm looking at also maybe there's something, as you said, a bio in the bio aspect of things, looking at the human body and how it can develop something from the antibodies that we get from being bitten. Because I noticed that in the Americas, the ethnic or the African persons of African descent has less likelihood of getting the virus the dengue after they have been bitten.
That'd be an interesting study to do.
That's a research. Yeah.
So we're actually kind of out of time, past our limit here, but I think we had a really good discussion, and we've got I think a good direction and information that will help us. But anything else to add real quick?
I'm good.
I'm good. Not from my side. I just think that we will just have to work on those areas that we're thinking of and seeing how we would put them out. We would actually,
Yep. I'm gonna go ahead and stop the broadcast, but we can keep chatting after.
Sure.
So